You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hi everybody, thanks for coming back here at Healing Voices Project. I'm Mike Torville. We're going to take a little deeper dive into a topic we talked about very recently with our friends Hayley Pepin and Ashely Dunn from Northstar Recovery in West Springfield, Massachusetts. We had Ashely and Hayley on to talk about Northstar Recovery and all that they do there, but we talked about EMDR quite a bit. It's eye movement desensitization and reprocessing. That's why we call it EMDR. Ashely and Hayley, thanks for coming back.
Thanks for having us.
Sure, yeah. Glad to have you. And we're going to do a little deeper dive into EMDR because I know at the last conversation we had, we said, oh, we should have talked about this. Oh, we should have demonstrated. There was a lot more we found we didn't and should have talked about. So that's why we're here today, right? To do a continuation, kind of like a part two. And this will be interesting because there was a lot of questions I had about EMDR and how it works, and we talked a little bit about that. But I think and I'll encourage people, if you're listening, to listen to the previous episode with Hayley and Ashely. But why don't we do a quick 1 or 2 minute overview, what your jobs are at Northstar, just if somebody's listening for the first time, they know who you are. Mm-hmm. And then we'll talk a little bit about EMDR, a 1 or 2 minute overview, and then we'll dive in. How's that? So, Ashely, why don't we start with you?
Sure.
Yeah.
My name is Ashely Dunn. I'm the program coordinator at Northstar. So my job consists of working with clients. I work with clients one-on-one. I do some group sessions. I do a lot of the intake process, so like when they come through the door, kind of getting them comfortable with the program. I will talk with the families also. So we have a family program that we have at Northstar, and so having contact with the people that are supporting the client outside of the program has been really important. And yeah, anything that has to do with operations or any kind of insurance, stuff like that. A little bit of everything.
You do a lot of everything, and you certainly come from a position of knowledge and relatability because you're a person in recovery yourself. Right. So yep. That certainly gives you some ability to relate and understand and be able to do your job more effectively.
Absolutely.
Yeah. And Hayley, what's your role at Northstar? Yeah.
I oversee all of the clinical operations. I'm the VP of clinical operations, so I oversee Southborough as well as West Springfield. I oversee the billing, all the clinical stuff. And just really try to make sure our programs are running efficiently and effectively, and opportunities for where we can grow and do better and support our clients.
And that's working because you're growing.
Right.
You guys have done a lot in a few years, right? You've been in West Springfield now for 2 years?
Yes.
Yeah,
that's crazy.
And you've been at Northstar for how long?
For 2 years. I started April of 23, and we opened our doors in West Springfield the end of May. 23.
You've been busy, yeah, and you're growing, yeah. So that's good for you. Well, I know we've got a lot going on at Northstar, but one of the programs that we talked about is the EMDR.
Right.
Yeah, and you're, I guess what we didn't talk about, you use EMDR, which is eye movement desensitization and reprocessing. It sounds a bit scary. I'm going to be reprocessed. What does that mean? And we talked about possible apprehension of people and misunderstanding and what it all is, and that's why I thought it was important to come back and talk a little bit more about it. But what I didn't ask is if you are going to administer EMDR, do you have to become certified, trained, all of that? Tell us about that.
You have to go through a training. It's a 40-hour intensive training to even be considered trained, and with that is an additional 10 hours of consultation after training. You have to have a master's degree and, be in the field. And I'm certified, so I've gone through even more training after that. But yes, you have to be EMDR certified, which is the governing body for EMDR.
So administering EMDR isn't just something you can say, hey, let's give this a try. You have to have training, certification, and there's a lot to it.
Mm-hmm.
Yes. And Ashely, have you gone through the training process yourself?
So that is the next thing on deck for me. That's what I'll be being trained for and being able to offer to that too.
So if somebody goes to Northstar and goes through the EMDR, who does it? Is it yourself?
So there's 3 of us that are trained and or certified in EMDR. And so it's not like a specific program that we have. It's just kind of a supplemental modality that we can offer. And it's going to be especially important for addiction, but also with the mental health program starting. Everything kind of goes hand in hand. The negative thought or the trauma affects everything.
It does, because you can identify, diagnose, for a better word, what underlying problems have caused addiction or depression or the root of trauma, right? From that. So if you're going through that, you just identified a few things, but how do you determine who's an ideal candidate for EMDR?
So everyone can do some facet of EMDR, even if it's, the resourcing phase, just to help increase their window of tolerance and be less triggered or dysregulated by life. But the actual reprocessing of it, somebody has to be pretty regulated with their emotions, just so that they don't become overstimulated or outside of their window.
So you'll have counseling sessions or meeting with a person before you're even, somebody's not going to walk into the street and say, hey, you know what, come on in, no. Right. There's a process of discovery,
right,
and to determine if this person would benefit from this therapy.
Right.
So eye movement desensitization and reprocessing. When you talk about eye movement, it's a lot of the bilateral stimulation that we talked about, eye movement, left, right, left, right, left, right, or physical, your hands move back and forth, or even audio. So there's several ways that you can, or tapping, and if you're listening, we're tapping the opposite shoulder with your hand, right? And that's it stimulates your body back and forth. And how does that help to trigger memories? How does the back and forth thing, what happens with your brain?
So it engages both sides of your brain, and it imitates REM sleep, the rapid eye movement that happens whenever you sleep, and the stage of sleep where we're processing memories and all of that. So it kind of imitates the same. It imitates it,
but you're conscious. You're not sleeping.
Correct. Okay. Yes, that's important.
Then not a natural question. So you're stimulating both your brain, both sides of your brain, whether it's with your eye movement, audio with your ears. So in other words, if you have a speaker or a headphone on, one side versus the other side, they alternate, or tapping yourself. So let's now get into how, if you're getting there, because I wanted to make sure if somebody didn't listen last time, get kind of an overview of what this is. And the purpose of this really is to bring out, and I'm going to say this, bring out old memories, maybe of trauma or something that you can help to desensitize, right? Or decrease the effect of the trauma. Is it
really kind of the negative thought that you associate with it about yourself? So whether it's feelings of safety, feelings of inadequacy, that kind of stuff, as it happens in the trauma, I'm not good enough, or I'm unsafe, or these kinds of things, getting a more adaptive thought pattern online, so that way you don't continuously fall into the unhealthy pattern.
The unhealthy, so you sort of unburden yourself with the weight of that negative thought. In other words, if it's like you said, if it would after a session, would somebody feel more confident or differently? Would they feel different after?
So,
Yeah.
so typically what happens is the disturbance level will lower. You know, the validity of the healthier thought will be more. And so the negative thought, the disturbance is lower. So it's kind of an opposite correlation. One goes up, the other goes down. And usually people feel, I mean, as Ashely said last time, tired and kind of like a relief.
Yeah. And I would say, I mean, even just with one session, it'd be harder to say like, oh, I feel like more confident now. But I think I was just kind of more at peace and calm, like over even the next few days, like when things were like if things were happening, I was just kind of at like a lower state of reactivity in general.
Okay, when you said the first session, so there's a series of sessions that you go through. How many typically?
Oh,
it varies, right?
Yeah. Right. That's
right.
a hard one, because if somebody has, you know, complex trauma and there's multiple things that have happened, it could take substantially longer. If somebody's window of tolerance is smaller, it's going to take longer to get there.
Mm-hmm.
And so it really just depends on the person, but I see it happen typically very quickly.
Okay. So do you think that memories that we have get altered, distorted, exaggerated over time that causes this behavior change?
Well, definitely. Well, we start to see things. We have our subjective reality, right? So the lens through which we see the world is colored by all of our previous experiences. And so if we are seeing everything through this negative thought pattern, then that's what colors.
So those negative memories might be amplified through distorted thinking,
right,
and layered over time, and it becomes different. And if you have two family members, let's just say they're remembering an event from 20 years before, and they each talk about it, and the other will look at it and goes, no, that's not what happened, right? Because it's a common thing, right? And so they become distorted over time.
Right, they're both seeing it through their own subjective reality. It's like if you take a dollar bill and I hold it up and I say, well, what do you see? And you say, well, I see a man. Well, that's weird because I see a pyramid. And so we're both looking at the same thing, but we're seeing different sides.
Do people say, let me have it and take a closer look? Let me see closer. So and that helps. And also, too, we talked about, just to address this, too, there's nothing to be afraid of when people go through this, right? It's not like you're going to have unintended consequences where they felt fine and then later felt like, what just happened to me? I feel miserable. I feel more depressed. Re-traumatized. That doesn't happen, does it?
No, I tell people, you know, processing can continue 24 to 48 hours afterwards. So you may have dreams about it. You like things may come up through the next 24 to 48 hours. But it's not, I've not had anyone say, like, I feel miserable, I feel worse. They've just continued to process certain things or had things come up that they're like, I didn't even think about that.
Well, see, that's good. And I guess maybe it's just me. I just think about, if I was about to go through this, I'd be like, I'd maybe start to hyperventilate. What's going to happen here? Am I going to come out of this and think of something that I've suppressed for a long time and now it's bothering me? That it's not the goal, obviously, is to do the opposite, right?
Well, and I think demystifying the process in the beginning is the most important. So, like, I will start off with something present day. Like what's something that's disturbing on like a level 3 out of 10, and that's what we'll start with. That's the very first thing we'll process. You know, I get irritated in traffic today. Okay, let's process that. And so that way they know what to expect moving forward.
Okay. And I think you're right. Demystifying, knowing what to expect is partly why we're talking about this, right? To remove that barrier that might exist with somebody. So with that, can you, I don't know how hard it is or how easy it is to do a little demonstration. Could you show us how this works? I mean, if it was on Ashely or on me, how if you're sitting with somebody, let's show us how this works.
Okay. So the first thing we would do is identify the first way I normally do, because different practitioners do it differently. So that's important to note.
Yeah.
Is identify either a negative thought that's bothering you today, or if there's a specific event, right? So what's some kind of.
So Ashely, we're going to zero in on you,
Yeah.
and I say this
And
because
this
if
is
somebody's listening and not, if they're not able to watch it but they're listening, I just want to make sure it's so you're going to, as if Ashely was your client, right?
As if she would. So and to be clear, this is more of like a demonstration and not actually. Ashely's not going to be intentionally processing
Right.
anything. But so an event. So what's an event that you would like to process?
So my brother, when he was a baby, he was very sick and he almost passed away at 3 days old.
Okay.
Yeah,
And how old were you?
10.
Okay. And so, through the history taking piece of it, and initially, we'll identify events and periods of time in someone's life. And then from there, like we have an event. And so, when you think about it now,
Mm-hmm.
what's the emotion that you associate with your brother was sick when he was 3 days old?
Like panic.
Okay. And what's the thought?
Anything can happen.
And if anything can happen with him,
Mm.
what does that say about you?
Yeah, well, anything can happen to me. I think when I think about this in particular, I think about just anything could happen to anybody that I care about.
Anything can happen to people that you care about.
Mm-hmm.
So, and there's panic. So, is there a sense, is it more unsafety or powerlessness?
Powerlessness.
Okay. And so now we've identified the negative thought, powerless. So powerless over, like, you're 10 being able to do anything about your sick brother who's 3 days old. Is that the first time that you felt the sense of powerlessness?
No.
How old were you the first time that you felt that same feeling?
4.
What was the emotion?
Fear.
Okay. And do you remember the event or just the emotion?
I do remember the event. My mom had a seizure disorder. And so there was a instance where she was cooking a meal and then went into like a grand mal seizure in the middle of cooking.
Okay. And so when we identify the earliest memory, we call that the touchstone memory. So that's when the seed is planted of, like, I'm powerless.
Mm-hmm.
And so instead of feeling powerless, how would you rather feel? What's a healthier thought?
I have some control for most of my life.
So I have some control or I can control what I can. Which one feels more true?
I can control what I can.
Okay. And now the sense of powerlessness, is this something that affects you today?
I think so.
Okay. And so from there, then I would have her identify a present memory of the same thought. And then
At what point, when you're going through this is the initial part, right? When you're identifying those memories, and when you get into the movement, the eyes, the ears, or hands, when does that, is that during this that you usually help the person
So this
recall?
is like kind of drawing a map to like where you want to get to use those things.
Yeah.
and so we call it a target sequence plan.
Mm-hmm.
And so then I, along with the client, will say, okay, where do you want to start? And so that way, especially with something like powerlessness,
Mm-hmm.
like then there's giving them their sense of power over this, even like where do you want to start? And I always say, like, I would suggest starting with a present day memory because it usually doesn't have as strong of emotion attached to it. And so, a 3 out of 10.
Mm-hmm.
And so more often than not, people are like, oh, okay, I'll go with what you suggest. But sometimes they're like, no, I really want to go. I want to start here. So, okay, well, let's try it. And, if you start to feel like it's too much, put your hand up,
Mm-hmm.
we'll stop, we'll start somewhere else, and kind of regulate.
And the nice thing is, again, just watching you guys go through this, you're fully conscious, fully aware.
Mm-hmm.
There's not hypnosis. You're not deep sleep. You're not set off in dreamland and REM sleep, anything like that.
Right.
You're fully in control.
Right.
Back to your control that you were looking for.
Mm-hmm.
But you're fully in control of this thing. Mm-hmm. And when you begin it's EMDR, eye movement, but it's not necessarily eye movement.
Right.
It could be hand movement or tapping or audio,
Mm-hmm.
right? When does that come in? Initially, I mean, this is just how do you start, and how does that help to trigger?
So from this, before we start processing, we would identify containment resources.
Mm-hmm.
Typically like a visualization of compartmentalization, or maybe a calm place that they can kind of picture in their mind that can help reactivity and emotions, like a calming,
Mm-hmm.
just a calming sense, or container. So Ashely's created a container in the past, and so I would say, okay, I'm going to remind you of your container, so at the end, if there are still things that are disturbing regarding this, I'm going to have you put it in your container and have her bring that up before we start. And then what we would do is go into so I use buzzers or tappers,
Mm-hmm.
and a lot of people do different things, and funnily enough, it looks like a very old school, just a very simple,
Mm-hmm.
and you can kind of change.
So
how
these
fast.
dials regulate the sound and the frequency.
Right,
Okay.
and in the hands. So there's headphones, but they just kind of vibrate, and in your hands. So
Mildly.
here, so
Oh, okay.
you would put one in each hand,
Yeah.
And over the
and you would put them like one on each side of your body.
Yeah.
And
And like resting my hands on my thighs
right,
here.
and
like
I always ask clients, like, I say, okay, now uncross your legs, and so let's make sure.
Yeah.
And then, so right here,
Oh, yeah.
this is on slow.
Mm-hmm.
So this is kind of just a calming,
Yeah.
keeping someone in the present. Like, it's very slow. Like, if someone was picturing their calm, safe place,
Mm-hmm.
it would be slow like that. It's just like
And they're both going at the same time, right?
well, they're alternating.
Okay. Okay.
So,
Yeah.
and as we process, just like the rapid eye movement, it would become much faster.
Okay. Yeah. Side by side. Yeah.
Right.
Yeah.
So then it becomes
Okay.
quick
Okay.
as opposed to the slow.
So if you didn't have these, you could just do it yourself with the shoulder. Yeah.
Right.
Okay.
And
right.
so that's what the I guess it would help.
Oh yeah, I can feel the alternating.
Mhm.
Yeah. And this helps your brain process.
Right.
And it's very mild. So there's nothing to be, and I've done through therapy, physical therapy, the TIMS.
Yeah.
And I was thinking it was going to just shock me. Not at all.
No,
Yeah.
it's just like a vibration.
It's just a vibration, just a subtle little, okay. That's not bad. And the same thing with the audio. It just goes back and forth until you almost forget it. You almost forget that it's happening, right?
Right.
But still, it's working. That's interesting. Yeah, it's not scary at all.
No. And so what I would do is, when we were processing, so I would have Ashely hold it, and I would say, okay, so I want you to think about what we just talked about. Okay, your sick brother, and the panic, and and the feeling of powerlessness, and I would turn it on, and I'm gonna just kind of walk through it. We're not gonna actually, and then I would turn it on, and we would go through a round. I usually do it from 20 to 30 seconds, and then I would turn it off, and I would say, take a deep breath. What do you notice? And then, the first time we did it, she said, I noticed like my head feels kind of weird, and I said, okay, do you notice anything else? And she was like, noticing some sadness. Okay, let's go with that. And then I would turn it back on, and your brain just kind of goes where it needs to go. It processes what it needs to process. There's not a wrong way to do it. And then, at last she said like a really vivid image popped up that didn't have anything to do with what we were processing. Said, okay, well let's just go with that, and let's let it happen. Let's let your brain process what it needs to.
So it's almost just like when water's like finding its way somewhere. So that's kind of how the processing works. So like when she would ask me, it's like, okay, so let's go with that. And then she'll turn it on and continue. And then it continues to kind of process on its own where like it needs to go. It's not really, that part isn't as much directed by her. The brain does it. So.
You just do it yourself. It just happens naturally.
Yeah.
And that water analogy was very good.
Like when you have a dream and it starts somewhere.
Yeah.
You're like, but then I was at this other place and there was these other people that didn't have anything to do with the, and so like when you're dreaming and you have seemingly random, weird dreams, it's like your brain is processing or just really doing what it needs to do.
Or jumping tracks.
Right. Or, you dream you're going to miss your flight.
Yeah.
Because your brain is preparing for the next day. Like.
And sometimes you wake up and you go, what the hell was that? I dreamt. But there's something if you start to dig into it. And do you talk about dreams when you do this?
So I've processed dreams before. Some, sometimes I had a client that was having like a recurring nightmare of something that had happened. And so we processed that instead of the actual event as almost like a precursor to processing the event. But yes, I've done dreams.
Why isn't this used more often?
I mean, I think it's growing pretty quickly. I think you'll hear more of it now than ever.
Because it's effective. It's working. It's nothing to be afraid of. I mean, people feel good after. You're having great results with it. I hadn't heard about it until I met you, Hayley, and wondered about that. Yeah.
And it's been around probably since the 80s.
Okay.
But what happens with any kind of therapy modalities is there has to be enough empirical evidence behind it before, the
widespread administration of
right,
it.
Before the governing bodies will
before
say,
it's accepted.
That's an evidence-based practice.
Yeah.
And so it's not something that even like insurances would recognize as far as being an appropriate way to treat someone until it has enough evidence behind it for it to be considered an evidence-based practice. So now, I mean, there's years and years and years of research in brain scans, because that was the first thing Ashely did was look at brain scans.
I wanted to see the brain scans because, and you can see pretty amazing stuff if you look that up, anywhere. scans before and after doing EMDR and like the activity in the brain and the way it changes.
That's interesting. Yeah. So after all these years, you'd think that it would, but it is. I say catching on. That's the wrong phrase, but it is being practiced more often because it's that effective. And does insurance cover it?
It's just a normal therapy session.
Okay, good. So there's no issues in terms of it. Okay.
It just depends if whoever the person that the practitioner takes insurance or not.
Oh, I see. Right. Just like any other therapy session. Okay. Well, that's very interesting. And what I like about seeing this is it would take my apprehensions away, because at first you hear that and you go, well, what is that? Is that electrotherapy? Is it, because it has that sound to it, right? EKG, EMDR is what we're doing here, but it's very mild. It's very calming. It's effective. People are feeling good afterwards, and you're finding not just, but it actually works and helps people to get through trauma or depression or addiction, right? And so are you finding that even in the last 2 years of Northstar, that you're finding you're using it more and more often?
We're using especially the resourcing, piece of it. I use it with clinicians, and on group supervisions, even with like resource enhancement and helping them to increase resources so that they feel more prepared to work with clients that have heavier stuff that they're going through. And but yes, with increasing window of tolerance and it's been really helpful. And even when people are appropriate for processing in early recovery, it's pretty incredible to watch.
Yeah, it is, and it sounds great. Now, Northstar Recovery, you what's the website? Northstar?
It's NorthstarRecoveryCenter.com.
NorthstarRecoveryCenter.com. And if somebody wants to call and find out, what's the phone number?
It's 888-311-0911.
Okay, well, that sounds great. Well, this is interesting. I always learn something. Every time I visit with you guys, especially, it's very interesting, and I appreciate you taking that. So, again, Northstar Recovery, Hayley and Ashely, thanks for coming in.
Thank you.
Appreciate that very much. And everybody, thanks for listening. If you want to know more, NorthstarRecoveryCenter.com. All right. Well, thanks again.
Thank you.
See you soon. All right. I knew I had to wrap up, so
Yeah.
timing.